my question to you, Dr. Samir Parikh, and you've been very inspiring to me. I've been following you, many of your, talks. So I came across this Deloitte study, right, that says that poor mental health conditions, again, in the context of work, we are going to, we lose almost $14 billion a year in terms of productivity, right? So, but the first step of mental well-being, like, the other stuff you spoke about, vaccination, everything is predictable, it's preventable, right? For mental health, first of all, first question is, we know that only few people speak up, right? The first step is people do not speak up. Because if kids want to talk to their parents, they know that parents are judging them, friends are judging them, an organization might really, do away with my career if I open up. So first question is, how do we ensure that people speak up? Second, what is it that, what can we do to make it preventive? Like vaccines and other, we spoke about preventive measures which can be taken. So before, this really becomes a huge challenge. Like I know another data says that hypertension, again, is going to be like in the highest, in another 5-6 years' time among Indians. How do we ensure the prevention happens? Third is, how do you measure success? Like other, initiatives, it's very easy to measure success. But how do you know who's a very, very successful psychiatrist, and how do you really measure success?
Last one is easy. I don't think we can define success. It's a very personal feeling. You need to feel good about what you do. You like what you do. You believe in what you do. Success can't be a blanket sheet for people. It may be a few zeros in the check for some people. It can be a few awards for some people. It can be number of people we are seeing. I think it just doesn't matter. I truly believe that at the end of the day, intrinsic motivation is what drives people. Most people, after a while, if you'll ask Sachin Tendulkar before he started his career, how many runs would you want to score? Would have probably said 1,000 runs would do, or 5 tests would do. But at 1,000 wanted to score 5 more and 5 more and 5 more. So I think that's what success is. I don't fundamentally believe in the difference between a successful psychiatrist or otherwise, or any medical practitioner. My take on this is very simple. Each person's qualified. My qualification of an MD psychiatry or any other person with an MD or DNB psychiatry, we've got the same education, same skill set, same upbringing, same evidence-based medicine, and can't be compared one to another. My other take on this is I believe younger people are far more aware than older people are. So if you were to ask me, should you go to a psychiatrist with a 20+ year experience like me, or should you go to a fresh psychiatrist who's just come out of residency, then go to that psychiatrist far more aware than I am. But on a different note, prevention of mental health, there is robust evidence. In fact, the WHO report in 2022 talks about it as well. That community mental health, which is community support systems, for us, it should be the easiest thing that comes to us. Culturally, we are people who've been connected. Culturally, it comes naturally to us. Big families, extended joint systems, that comes naturally to us. It's a preventive factor. And in COVID, you will realize that people who had good support systems did actually better than those who didn't, not just the medical component I'm talking about. So preventive is life skills, psychological first aid, awareness, early intervention, giving skills to navigate life right from young people. That has to be the aspect. And obviously lifestyle, everybody's been talking about lifestyle. You keep sitting and watching TV, you will not be fine. You keep scrolling your social media, you won't be fine. You don't do other things and you won't be fine. It's not rocket science, it's common sense. And I think these aspects need to be looked at. As far as the data that you were saying, like I said, 12 billion years are lost per year to depression and anxiety. Again, a fact. What you do, you find and identify those individuals who are struggling without any reason. All they could have needed was probably an SSRI, and in 4 weeks' time, they would have been back on their feet. Or maybe 3 or 4 sessions with the cognitive behavioral sessions, and they would have been fine. I think it's time we understand that. And to the first part of your question, this is also a way you are changing things. The more you talk about mental health, the more you have conversations around mental health. As an organization, your policy, your vision statements, your mission statements must include well-being and mental health. And you encourage your employees to talk about mental health. If you don't do that, then people will think, what if I talk about my mental health and these guys will fire me?
Thank you, Dr. Samir Parikh, for very well explaining the mental health issues and importance of supporting employees in their mental health management. That is why the awareness is increasing and more organizations are now starting EAP services for providing mental health support. I've seen one data from 2022 of pre and post COVID. So there is an increase of almost 5-6 times in the utilization of EAP services, especially due to COVID lockdown situation and other things. So I think more and more organizations are now accepting this, that this is not only physical health, this mental health is much more important than the physical health issues, and they are providing this EAP services.
Sir, I have a question. I am from NHPC Limited. Usually our sites are in a remote places, and our dam sites are further more remote places. So when employees are posted there, most of them away from their families, they come up with lots of psychosomatic disorders. And well, some of them have real problems, and some of them malinger it, thinking that doing so they will get a transfer to better place. So how to handle those employees, sir?
I will not agree to the last part, only because even if there was an occasional person who was trying to use any medical problem, whether it is mental health or a cardiac or a physical one, for some external benefit, that's a blanket statement applying to all medical fields. It's not that you would use mental health reason to be able to escape things. I think we need to get out of this thought process. That's one aspect. Psychosomatic concerns, ma'am, as real as they get. Psychosomatic, psycho, body, psychological, soma, body, the psychological impact on body. It's very much real. People who are away from their family, have different kinds of pressures, may go through more psychological distress. That's a fact. They need to be given intervention. Intervention would involve, especially involve therapeutic processes, and some of them will require medical intervention. And I think that's where, like I was saying, telehealth, telemental health is the solution for the outreach. There is no way you'll be able to send a psychiatrist or a psychologist consistently there. Practically not possible. There aren't enough of them. And just adding on to one thing, sir, when you were talking about EAP, I think it's very important that next time when an EAP comes to you, the question you ask is the EAP also involving the clinical psychological intervention? Is the EAP also providing you for a psychiatric consultation? Because if that is not happening, and if you are purely giving coaches or half-baked psychological intervention, then a person as simple as a panic disorder, who could have been given a medical intervention and would have been probably 80 on 100 fine within 3 or 4 weeks' time, might waste 3 months before some other person tells them, why haven't you seen a doctor? So I think you need to look at EAP, and that's why I was saying this in my talk as well, from a clinical standpoint, not from only a psychosocial standpoint, which is the more conventional semi-HR, semi-OB psych. When I'm not talking organizational behavioral psychology. That could have been a different conversation. I'm talking pure mental health, mental illness, medical interventions, evidence-based treatments for conditions which are diagnosable, be it you use the ICD-11 or DSM-5-TR.
Thank you, Dr. Samir.